Alright team, so in this next set of videos, we're going to be looking at the deep dorsal muscles in the back. So we're going to be looking at, again, dorsal being like the backside of our cat, since it's a four-limbed organism, but our posterior muscles that are deep in humans. Those are the ones that we're going to be looking at. So for these deep dorsal muscles, our main goal when we're looking at these is to try to understand how they affect the motions of our spine and how they support the structures that are around that area, providing us our ability to essentially stand upright and providing that tension that we need in order for that to happen. So for these deep muscles, what we've done is we've removed the trapezius so we can see below it. So the trapezius is, if you see it here, it's reflected on this side. It's now been removed and we're able to see the deeper muscles going through. So a lot of these muscles, again, are going to be directly moving stuff in your shoulder, elevating your scapula, depressing your scapula, moving those things around. So the first muscle that we're going to look at is the levator scapulae, or in the cats we also see the levator scapulae ventralis is another name that you'll see it called. But the levator scapulae, its main job is to elevate the scapula and bring it up. So if you're thinking like the side of your neck where your sternocleidomastoid was, the levator scapulae is that kind of deeper muscle that's on the back of your neck right here. So you can actually feel it if you lean to the side and you press on this posterior portion. After you've rotated your head, you can actually feel where that muscle is. So with the levator scapulae, its origin is the transverse process of the first cervical vertebra, so it starts medially, and it's going to insert onto the vertebral border of your scapula, or that medial border of your scapula. And what that's going to do is allow you to elevate it. So if you contract this muscle, your shoulder will go up and your scapula will raise in elevation. Okay? So levator scapulae, when we look at it in the class, in the cat, you'll see it's actually a pretty wide muscle. They use it to really support their kind of slinky walking that they do. They use that muscle quite a bit in order to make that happen. So again, another repeat that we talked about was the serratus anterior, or a muscle we talked about before. The serratus anterior is kind of being this anterior muscle, but it also functions as a deep dorsal muscle. It's going actually below and underneath the scapula and providing support under there for that muscle, or for that structure. So with it, it's going to, again, originate on the anterior and superior margins of ribs 1 through 9. It's going to insert on that anterior surface on the vertebral border or the medial border of the scapula. And again, like I said with it before, it's going to help rotate the shoulder and bring it back and protract it and retract it back and forth. So it assists in that action. It's also going to abduct and medially rotate the scapula. So again, bringing it in, like if you're taking your arm and you're rotating it backwards, that's what it's going to allow you to do. The next set of muscles, the rhomboid major and minor. In some books, you'll see it called the rhomboides or the rhomboidal muscles. But with these, there's actually two separate muscles that kind of almost look like they're fused as one. But they carry out very different functions in terms of what they're trying to do. So even though they kind of behave differently in humans, we are learning them sort of like as one muscle, because in the cat they kind of function as one thing. Right? But with the rhomboid major and minor, again, the origin of that is going to be on the spinous process of your cervical and lower thoracic vertebra. So you're going to start here with like C5 through and C7. So 6 and 7 are going to do that, and then the rest of your first 4 thoracic are going to be with your rhomboid major. And then it's going to insert onto that vertebral border of the scapula. And again, its main job is to hold the scapula back and adduct it to the center of the body, and helps you rotate it laterally. So depending upon how the action is being pulled on, it's going to allow it to rotate and bring it in. So if you're thinking about isolating that muscle, it's deep, so it's bringing your vertebra in and out, or not vertebra, scapula in and out as you're rotating, and thinking about if you're waving at someone, putting your arm up and down. It's a weird way. The next muscles that we'll go through, well, we're going to look at 5 of them, and 4 of those muscles are directly responsible for the movement in your rotator cuff. So one of the things that you might have heard is people have had if you watch baseball, for example, a pitcher has experienced a serious rotator cuff injury or tore their rotator cuff. Essentially what they're talking about there is that they've torn some of the muscles and ligaments that are directly tied to that particular area. So they've either torn their supraspinatus, they've torn part of the tendon. Again, all of those are different structures that could potentially be associated with that rotator cuff. So we call it the sits muscles because these 4 muscles are probably the ones that are, I would say, the most regularly worked on if you're a physical therapist and you're helping people move who've had those arm injuries. But these are the 4 that come up pretty much most of the time. They're the most common ones. So for these muscles, the first one in your SITS acronym, so we call it the SITS muscles just to help us remember the name of each of them. The first S refers to the supraspinatus. So the supraspinatus, if you remember when we looked at the bones in your scapula, you had your supraspinous fossa and your infraspinous fossa. Well, in that supraspinous fossa, you have your supraspinatus, so the muscle that sits in the area that's superior to the spine of the scapula. And so with the supraspinatus, because it's a rotator cuff muscle, right, and adding and essentially bringing the abduction, like helping you bring the arm away, it's going to insert onto the greater tubercle of the humerus. So going kind of from this posterior side here, wrapping around the other side of the shoulder and allowing you, again, to abduct your shoulder. And so with the supraspinatus, when it gets damaged, you lose that ability to like draw your arm back and provide that additional strength that you might need if you say you're throwing. The next letter in your SITS, which is the I, stands for the infraspinatus. So again, the infraspinatus muscle sits in the infraspinous fossa of the scapula, again, a structure that you've seen in our skeletal work. For the insertion of this, again, they're all going to insert on the greater tubercle of the humerus. Their job is to bring in that part of the humerus, and this is going to assist mostly with lateral rotation. So when it reacts, or when you fire that muscle, it's going to go out like this. Right? It's what's pulling down on that part and causing the arm to go out in this direction. So if you're going from anatomical position, it's allowing you to bring it out this way. This muscle, which is the T in your SITS muscle, this isn't the T in your SITS muscles. It's part of it. It's related to it. It's next to it. But the teres major is a muscle that allows you to adduct and move your shoulder in. It's actually going to insert more on the surgical neck area of the humerus, following that intertubercular groove, so going down kind of past the intertubercular sulcus that we saw and identified on the muscles. So the teres major, when we look at it in the cat, is a little confusing in terms of how it's structured. So just try to remember its origin and insertion as you're looking at it, because that's going to really help you identify where it is. So looking for that origin on that inferior angle of the scapula is going to be vital to make sure that you get that it's different from the teres minor that we're going to look at here in a second, and that it's different from the rhomboides muscles that we just looked at. Okay? So again, really looking for that insertion here, because it's going to then go over to a different part of the humerus that we're not necessarily going to see because of the fact that we're not going to do the section into the shoulder because we would ruin a bunch of arm muscles. So some of the muscles that we'll be looking at, again, are going to be covering portions of this, but the teres major, we'll see it kind of with the teres minor on that lower portion of the scapula. So the teres minor, this muscle, when you're looking at the cats, again, is part of that rotator cuff inserting into the greater tubercle of the humerus, but it's going to be a little bit more lateral than what we see with our teres major, and it's going to be smaller. Like, and the same is true on the cat, unlike some of the other major and minor muscles that we've seen. It's going to be smaller on the cat than it is on compared to the teres major. Same for humans. And so it's going to insert on the or originate on the lateral border, insert on the greater tubercle, and again, allow for lateral rotation, again, helping you bring your arm out as part of that rotator cuff. Okay? So again, all of these muscles firing, allowing you to do this motion here. The final muscle of your SITS structures is going to be your subscapularis. So if you remember, we looked at the scapula, we looked at a fossa called the subscapular fossa. That's where your subscapularis sits. So the subscapular fossa, below the scapula, it's going to be facing right onto the ribs. And its main job as the subscapularis is to insert, again, on the tubercle, this time kind of more around onto the front, to the lesser tubercle. And it helps with medial rotation of the shoulder. So when it contracts, it's actually bringing your shoulder, allowing you to rotate it forward. So it's actually pulling on the front of your humerus to bring that around. So again, the rest of the SITS will bring it kind of back and rotate it up and down this way. The subscapularis pulls on the front of it and allows you to bring it back this way. The next set of muscles, looking at the splenius, etc., these are muscles that are going to be actually kind of more medial, but also still a little bit deeper than what we saw with our levator scapulae. It's going to actually go below that, and we'll see kind of where that muscle shows up, kind of peeks through a couple different other ones. And so with the splenius, or the splenius, both of those names are fine. It's going to originate on the spinous process of the lower cervical vertebra, so it's going to be kind of running this entire length here. And it's going to be inserting then on the mastoid process underneath the skull. So again, it's one of those that allows you to extend the neck kind of sideways and back, and it allows you to rotate the head laterally. Like if you are, say, looking down or looking to the side, it's what's actually moving as you move your neck around. So in this image, there are a couple different ways you can split the splenius into the capitis and the cervicis. Can't ever say that word. But with that split, we're just learning it as a splenius, as being this large muscle that shows up in the cat. We have a hard time discerning between the two different parts of it. There's not a good delineation. But again, just knowing that it's, again, deep and aligned with the levator scapulae, you'll be fine. The last group of muscles that are here are the kind of very, very deep muscles that run the entire length of the spine. And so these are going to be ones that we'll see after we do our initial dissection and looking at the trapezius, trapezoid, or trapezius muscles in your latissimus dorsi. We'll actually remove those so you can see the different runs of muscle that are going down the length of the back. So with these muscles, their main job is to provide support and extension, flexion, motion, rotation around the spine. They're like pulling on parts of the spine to allow that whole entire area to move. And so the longissimus, this group is known as, and again, when I say group, it's like several different muscles that are working together. But the longissimus is really long. It runs the entire, almost the entire length of the back. And it's going to originate in the lower cervical vertebra and in the upper lumbar, and it's actually going to go all the way up the back and insert onto the mastoid process of the skull. So it runs that entire length, and then depending upon how you fire it and how much you fire it, you'll get that extension into the vertebral column, allowing you to bend backwards. But if you just use one side or the other, that's going to cause you to go sideways, left or right. So again, together, when you have the left and right firing, that's going to help you extend the vertebral column, again, so like you can lean back and look up. And if you just flex one of those, it's going to laterally flex the head or vertebral column to the side. So you're like doing like this, to the side, or to the side. The spinalis dorsi, again, spinalis means spine, dorsi referring to the back, so that's like your back spine muscle. The spinalis dorsi is going to start at the spinous processes and the transverse processes of all your cervical, thoracic, and the first 2 or 3 lumbar vertebra. It doesn't go down to the lumbar or into the sacral vertebra. And it's going to insert, again, going all the way up to the mastoid process of the temporal bone, so going like all the way up here, as well as it's going to insert on some of the transverse processes in the lower portions of your ribs. So again, running into that support the entire length of the back. So again, pretty close to the spine. Again, insert all the way up here from its origin all the way down the spine. This action, again, is the same as what's going on with the longissimus. It helps with extension in the vertebral column, and then if you fire one side or the other, you're going to have that medial lateral rotation, and then that lateral flexion that you're going to see in your head or neck if you contract it. Again, these muscles are smaller than your longissimus, not quite as strong, but they, again, work together to allow you to do that range of motion. The last muscles that we'll look at in this group are the iliocostalis muscles, or the iliocostals. The iliocostalis is a series of different muscles that originate on the borders of the ribs and the iliac crest, and they run kind of more laterally, and they run the entire length, again, of the back from your ribs all the way down to that iliac crest. And they're going to insert on the transverse processes of all your cervical vertebra and the inferior surfaces of the ribs. So it's going to like insert on the underside of all of these ribs, and it's going to go underneath here, around to the neck, kind of going deep and attaching to all of those cervical vertebrae. And so its main job is to help with extension of the vertebral column, but also allows you to move the ribs. So like if you take a deep breath and you like get really into it, one of the muscles that'll pull on the ribs to help expand the cavity is going to be that intercostal group. So if you remember when we talked about the skeleton and we had those articulation points with those facets in the rib that were attaching to the thoracic vertebra, again, there's a little tendon that's there, and there's a little joint that's there that does allow for motion with the ribs, which again allows the ribs to kind of expand a little bit, to open up the cavity as a whole so that you have more space for air. So we're going to stop there with the muscles in the back, and then we're going to move on to muscles in the arm, and then so on.